www.healthcmi.com. Today, acupuncture alleviates coronary artery disease. Published March 22nd, 2019 at healthcmi.com. Simply click on news to take a look at the full article. Acupuncture potentiates coronary heart disease drug therapy. Patients receiving acupuncture combined with usual care had greater positive patient outcomes than patients receiving only drug therapy. In a clinical trial conducted at Nanyang First People's Hospital, acupuncture combined with drug therapy produced an 85% total effective rate for the treatment of coronary heart disease, also known as coronary artery disease. Patients receiving only drug therapy had a 62.5% total effective rate. The researchers note that the application of acupuncture, quote, can significantly improve blood lipids, blood pressure, heart rate, and electrocardiogram indicators in coronary heart disease patients while reducing coronary artery plaques. To see the full article, go to the news department and click on it and take a look, because it will break it down. You can see the changes in cholesterol levels, mean arterial pressure, heart rate, T-wave amplitude in leads V4 through V6, and so on. Just as importantly, reductions of necrotic tissue and levels of plaque in the arteries. What I gather from this research is that while patients are receiving drug therapy, those receiving acupuncture have significantly better results. This could be for several reasons. One, acupuncture is relaxing the patient and helping with blood circulation. And I think that goes to some of it. And two, acupuncture seems to have either an additive or synergistic effect with the drugs. This may be the leading the channel concept, wherein acupuncture is applied and then allows the drug delivery mechanism to be more effective, because drugs do need to get to a certain spot. And this acupuncture protocol, including CV17, Danzheng, that is the influential point or the front move of the pericardium. It helps to go to the pericardium channel, channeling those herbs to where they need to go, those drugs to where they need to go. PC6, Neiguan, again, also pericardium 6 Neiguan, that is also helping to the heart. Same with PC4, Shimen, stomach 36, helping with the overall qi circulation, and bladder 15, Shinshu. Now keep in mind that that is the back shu point of the heart. Again, helping the medicine go to where it needs to go, but also the treatment in and of itself is beneficial to the heart. No one is saying that the application of acupuncture alone can do all these things, but clearly, when we combine it with drug therapy, we're getting better results. There's some other investigations covered here. In another investigation by researchers at the University of California, Los Angeles, UCLA, researchers find that acupuncture is effective for protecting the heart. Now, this was a lab experiment, but electroacupuncture to PC5 and PC6 in rabbits with coronary arterial occlusion resulted in less ventricular arrhythmias. There were additional benefits. Electroacupuncture decreased heart infarct size, so it protected the heart from tissue death due to obstruction of blood and oxygen supply. And moreover, the researchers showed that electroacupuncture caused a decrease in left ventricular dysfunction. A decrease in harmful ST segment elevation was observed. That was published in the American Journal of Physiology, Heart, and Circulatory Physiology. So 3 pieces of research are presented here. Pretty interesting stuff. Now, the question is when can this integrative medicine approach be protocolized into standard care? It's no fun to be lying around a hospital for any reason. And the acupuncture provides a very nourishing, a very relaxing recharge, a time for people to get healthy. For people who are experienced with acupuncture, many types of treatments are deeply relaxing and deeply restorative, not just in sports medicine and recovery from things like arthritis, but in this case, working together with a drug treatment protocol for people with plaques blocking the arteries. I find this very significant research because there's other supporting independent investigations. And that's important because we can't just go on about one piece of research, but the evidence is now mounting that acupuncture has an important effect in protecting the heart. To learn more, visit www.healthcmi.com. Thank you for listening.